102 health facilities are about to go dark. This is Kenya News Update today. Coming up, you'll discover how a global funding crisis is forcing a last resort decision in South Sudan, leaving thousands without care. Meet Health Minister Sarah Cleto Rial. On January 13, she sent a letter that would change everything. A financial review of a World Bank-backed health project revealed a devastating shortfall. The solution: withdraw support from over 100 facilities to keep the program alive. But here's the twist. This isn't just about money, it's about a system on the brink of total collapse. For 9 years, South Sudan has relied on the Health Sector Transformation Project, or HSTP. It's a flagship program designed to deliver basic care in a nation shattered by conflict. The ministry tried everything to close the funding gap. They cut indirect costs. They slashed program overhead. But it wasn't enough. The letter calls this a painful, last resort decision. The goal? To prevent the entire project from imploding before June 2027. And then something shocking happened. The ministry had to choose which facilities to cut. The criteria, security conditions, functionality, and whether services were duplicated nearby. Health centers already shut down by violence were first on the chopping block. The ministry admits the impact will be severe, especially in remote, conflict-affected areas where subsidized care is a lifeline. But here's what nobody's talking about. This decision was made with the blessing of major UN agencies. UNICEF and the World Health Organization were consulted. They agreed to these cost-saving measures. The WHO itself is warning that cuts to international health aid are causing service disruptions worldwide. This isn't an isolated incident. It's a symptom of a global retreat. The seismic shift is happening now. Upper Nile State is the epicenter of the crisis, losing support for 28 facilities. That includes 3 county hospitals and 25 primary health units. Western Equatoria loses 20. Central Equatoria and Jonglei face significant cuts. Every single state is affected. Governors are now being told to lead the transition, to find local support, to somehow keep essential services running. But South Sudan's health system was already fragile. Years of war, chronic underfunding, and poor infrastructure mean many communities already travel for days to find a doctor. This decision pushes them further into the shadows. Some say this is a necessary evil to save the broader program. Others say it's abandoning the most vulnerable. But if the World Bank and UN partners can't secure the funds, who will? The ministry's letter holds one haunting line. While these measures are painful, they are necessary to protect essential health services from abrupt disruption. The implication? Without these cuts, everything stops for everyone. The tension is clear. Sacrifice 102 to save hundreds more. But for the mother in Upper Nile who just lost her nearest clinic, that's cold comfort. Her journey for care just got much longer and much more dangerous. Do you think cutting off 102 health facilities is the right way to handle a funding crisis? Or is it a failure of the global system? Drop your take in the comments. Subscribe to Kenya News Update today for more on how international decisions hit home.